Hello everyone, welcome you all in the another video tutorial. So in this video tutorial we will discuss about the blood smear. So let's start with the introductive part. So basically a blood smear is a blood test which is used to diagnose the abnormalities in the blood cells. So let's understand first about the blood cells. So basically we know that blood is type of connective tissue found in the humans and other organisms also. So the blood cells are called as hemocytosis and many other names, which make up about the 45% of the total blood volume of organism, and the rest of the percentage or the blood volume is made up of blood plasma. So these blood cells are of three types. So basically there are three types, which include red blood cells, which are also commonly called as erythrocytes, and these blood cells are anucleated and they do not also have some another cellular organelles. So the red blood cells are red in color due to the pigment named as hemoglobin, and these blood cells have the function of carrying oxygen. Now the another type is white blood cells, and they are also of three types named as lymphocytes, monocytes and granulocytes. So the white blood cells are also commonly known as leukocytes and WBC, and they have the main function to protect the organism by different types of infectious agents, and they have the ability to perform phagocytosis. Now the third type of the blood cell are commonly called as platelets. So these are the types of blood cells found in human as well as in other organisms. So basically a blood smear is also defined and also referred to as a peripheral smear for morphology. So it is an important test in the field of medical, and it is used for evaluating different types of blood related dysfunctionings and blood related problems and diseases, like such as those in red blood cells and white blood cells and platelets. So if any of these blood cells have any problem or any disease, this can be diagnosed by a test named as blood smear. So let's start with the introductive part about the blood smear. So there are some characteristic features and some basic facts about the test. Let's understand. So as we have discussed that it is a type of blood test that look for the abnormalities in the blood cells, and it include all the types of blood cells including RBCs, WBCs and platelets. So the test diagnoses all the abnormalities in the number and shape or the type of the blood cells, and that's why it is considered as qualitative and quantitative blood test. So the blood smear can diagnose all the abnormalities in the red blood corpuscles, abnormalities in white blood corpuscles, as well as any type of abnormalities in the platelets of the blood cells. So besides, there are some other automated tests also to perform the blood test and to diagnose the disease of the bloods, like CBC, which is also named as complete blood count, which is also performed by a technician or physician, but it only resembles the total count of different types of blood cells. But the blood smear under the microscope detect a wide range of changes that give clues to the underlying test, and it also evaluate and describe the abnormalities found in the CBC or complete blood count, like shape of the cell or any other abnormalities found in the RBCs, WBCs and the platelets of the blood cells. So the question arises that what are the purposes of the blood smear and why it is done. So basically the blood smear is done to diagnose different types of diseases, like it is often done to diagnose jaundice, anemia, and to evaluate any infection caused by any bacteria or by any virus, and also done to confirm sickle cell diseases and to find causes for the enlargement of spleen, liver and many other body parts. So basically, it is used to confirm the sickle cell anemia by diagnosing or by describing the shape of the RBCs. We know that sickle cell anemia is the genetic disorder caused by the genetic or inherited problems by parents. And similarly, anemia is also a problem which is also considered as a lack of hemoglobin. Similarly, there are some other problems like it is also used to look for malaria by the count of platelets in our body and to confirm the symptoms of bone pain, to look for the causes of bruising and excess bleeding like hemophilia or many other diseases. And with a low blood platelet counts in our body, it is used to determine if the cause is increased degradation or decreased production based on the size of the platelets. So these are some reasons and purposes to perform the blood smear test by any doctor. So now let's discuss about the procedure of the blood smear test. So the blood smear test is very important test and play a crucial role in the speedy diagnosis of certain infections or diseases caused in the patients due to the abnormalities in blood cells. So there are several steps which are followed by the technician or the physician on the process of performing blood smear test. These steps starts by the obtaining 5 ml blood from the patient. So at the first step, the blood samples are taken from the patient by the help of serum, and these blood samples are stored in the bottle or a test tube which is containing an anticoagulant substance which is called as ethylene diamine tetraacetic acid and commonly known as EDTA. So we know that our blood have the coagulant natural tendency. It can coagulate within 2 to 3 minutes, and these anticoagulants have the ability to prevent the blood from clotting. And after that, the sample is used to perform blood smear test. Now in the another method, this method include preparation slide for the testing. So in this step, a slide is prepared, and in this slide a mixed drop of blood which can be 1 to 2 mm in diameter is placed in the center line of this slide. And after that, the slide contain the blood drop is called as the base slide. And another microscope slide which is named as spreader slide is used to spread the blood drop with the help of this spreader slide. So basically, the smear is made with the spreader is inclined at an angle of approximately 30 degree to the blood so that it can be spreaded properly by a proper thickness. Now the another step include staining of this blood sample. So the dried smear is then fixed with methanol or ethyl alcohol and then stained, and after that the smear is covered with the stain for approximately 10 minutes, and after then it is diluted with water. So after the dilution, it is allowed 10 minutes for the cells to prepare properly thin, and then it is dried. So after the drying, it is observed under the microscope to observe different types of abnormalities and different types of problems or different factors like number and shape of the different blood cells including RBCs, WBCs and platelets. So this is the procedure for the blood smear test which can be performed by any technician and any physician. Now there are several observations which are made on the basis of the blood smear test, and these observations includes size of lymphocytes, size of neutrophils and size of eosinophils. So on the basis of observations on the size of these types of WBCs, it can be diagnosed about the diseases or infections in the patient. The increased size of these lymphocytes and neutrophils and eosinophils indicate any type of infection in the patient. So some other observations include about the sickle cells which indicating sickle cell anemia in the patient, which is a type of hereditary disease. And there are several nucleated RBCs which can be observed in the patient, which is also a type of abnormality because the normal RBCs are anucleated and they do not have nucleus. Now the blood smear test also finds some findings from the CBC which include red blood cell count. So here the degree of color of these RBCs considered as hyperchromic and light red cells which are referred as hypochromic, they indicate the iron deficiency anemia in the patient. And there are several other which like presence of some inclusions which are including parasites and it indicate any type of infection. And there are several abnormal RBCs like nucleated RBCs which are also indication of abnormality in the particular red blood cell. These are some observations based upon the results of blood smear test performed in the patient. Now let's discuss about the risk factors while performing this test. So basically a blood test or a blood smear test is a low risk procedure. However, it includes several minor risks like dizziness or vertigo or fainting from the sight of blood, and it also includes soreness or redness at the punctuature site due to several small or minor bruisings, and there are very low risk for different types of infections caused by the blood test. So in this video lecture we have discussed about the blood smear test, its procedure and observations or disease diagnosed by the blood smear test. Thank you.